Collaboration is a new Engage Consult feature which allows organizations to share requests from patients with other organizations, ensuring patients can access the right care at the right time and place that meets their needs, and makes the most of valuable NHS resources. Organizations can choose to share requests with colleagues or groups in other partner organizations with whom they have a data sharing agreement in place. It supports collaborative working in PCNs and wider community services. For example, extended hours, community nursing teams, and local pharmacies. When a group or colleague from another organization is shared with your organization, you can assign requests to that group or colleague. Organizations can share and cover colleagues and groups in the same way they do for groups and colleagues at their own organization. This will considerably increase the value of Engage Consult within networks of practices and with other providers. Implementing collaboration requires organizations to have robust information governance procedures in place. We recommend that organizations using this feature have a data sharing agreement in place between all parties. At all times, Engage Consult takes account of a patient's data sharing preference. If a patient has decided not to share their data with other healthcare organizations, then only the organization they send the request to will be able to see the request. Should that organization feel they need to override the patient's preference not to share their request, it can, but will be prompted to provide a reason for overriding the patient's preference. Organizations can also restrict the view of shared requests. This ensures that organizations that have sent requests to another organization only see their requests and not those of other organizations that may have also shared requests with that group or colleague. Access to primary care services is expanding. Patients' expectations include having access to medical care 7 days a week and outside of the traditional practice opening times. Practices can configure their system so that their out-of-hours and extended access provider can check their incoming requests and deal with them when the practice is closed. Working collaboratively can provide your patients with access to appropriate, safe, and effective online consultation 24/7. Organizations can create a hub to manage incoming requests from patients. Here are some examples of how you might configure Engage Consult in a PCN. Set up a central team to assess all incoming requests and assign them to the most appropriate team or person. Use collaboration to send all routine admin and medical requests for care homes to a central team. This team can assess the request and offer the most appropriate consultation solution: online secure message, video consultation using Engage Consult's video consulting, or a home visit. Collaboration through Engage Consult is available 24/7, provides a downloadable report for saving in residents' records, and aids shift handovers to ensure residents receive prompt care and support. Pharmacists are playing an increasingly important role within practices and PCNs. Engage Consult's collaboration can be configured for all prescription queries, requests, and medication reviews to be managed by a central team. When patients contact the practice for an appointment or with a query, care navigators will quickly assess who is best to care for that patient's needs so that the patient gets the right care at the right time and in the right place. Using collaboration, care navigators could complete an online request on behalf of the patient and assign the request to a shared group or colleague who is best placed to meet the patient's needs, making the best use of valuable NHS resources. These are examples of how you might configure Engage Consult for a PCN, but there's no reason why it couldn't be configured in a similar way to cover other healthcare systems or multiple PCNs. Collaboration enables organizations to assign requests to clinical specialists working in the community or within the PCN. Here are 2 examples of where collaboration has been used to manage patient care. Not all practices have access to specialist nurses for all chronic diseases. Working in partnership with your colleagues in primary care, your patients could, where needed, have access to specialist advice by using collaboration. Collaboration, along with our outbound messaging feature, can be used by practices to manage patients for long-term conditions. Requests can be shared with a specialist nurse within your PCN or group. Additional information and questionnaires can be sent to patients using outbound messaging to enable comprehensive remote consultation of patients and signposting to the most appropriate service or clinician for their needs. Musculoskeletal conditions account for approximately 30% of all GP consultations in England. First contact practitioners, physiotherapists with enhanced skills, are now widely used in practices to manage patients with back and joint pain rather than waiting to see a GP. Engage Consult's comprehensive questionnaires capture clinically relevant information from patients with musculoskeletal conditions. Requests can be assigned directly to the practice, PCN first contact practitioners, or a local musculoskeletal service. Engage Consult can be set up so patients can send requests directly to the most appropriate service, for example, mental health, MSK, or sexual health. When one of these services receives a request, they can handle the request, or where clinically appropriate, assign the message to the patient's GP practice. If the preference is for all requests to come to the patient's practice first, the practice can assess whether to pass it on to another service or not. We live in uncertain times, and there are always circumstances that arise occasionally that require us to implement our business continuity plans. Working collaboratively with your PCN colleagues and those in the wider healthcare community, practices can utilize Engage Consult to help manage these unforeseen situations. Engage Consult can be used remotely, so is ideal for staff working from home or in isolation, such as during pandemics. Sudden sickness or practice closure due to fire, theft, floods, or loss of utilities can all affect access for patients and be a logistical nightmare for practice managers. Collaboration can be used by practices to help manage patient demand by sharing online requests with neighboring practices or organizations where you have a data sharing agreement in place. This will ensure that your patients can still receive prompt advice and support, even when you've had to unexpectedly close your doors. There are a number of benefits for organizations who use Engage Consult collaboration. You can share specialist skills and knowledge for the benefit of all patients in your PCN or group. Create virtual hubs to handle online requests for a group of practices. Share requests with extended and out-of-hours providers, providing 24/7 responses to requests 365 days a year. Access Engage Consult remotely, supporting home working or staff working in isolation. Use it with all the main clinical systems as it's fully interoperable with them. Always see who's handling your requests and the progress of the requests. Improve care for patients by ensuring they have access to the right person at the right time for their condition. Share requests with other healthcare colleagues, reducing the workload for GPs. Increase patient satisfaction by extending access and making sure they're seen by the right professional first time. Reduce referrals to secondary care services for conditions that can be safely managed in primary care settings. Manage unforeseen circumstances seamlessly. If you'd like more information about collaboration in Engage Consult, or would like to discuss how to set it up in your locality, please email consult@engagehealth.uk, phone 01263 834 648, or speak to your account manager.